Well, we'd like to welcome you to the Fall for Fitness Fall Prevention presentation today. Thanks for coming and supporting us. We have teamed up with Rehabilitation and the Fitness Department to partner to bring you more services. So this is an example of our partnership today, and we'll have lots more to come. We'd also like to mention that in November, the Rehabilitation Department will be having a class in the fitness studio or just outside of it. And please look in the connections for that. They will be doing that, I believe, once a week and hopefully continue doing that. So that will be part of our partnership as well. So we have lots of things in store for you today. It'll be some engaging things that you'll have to do. It's nothing big, right at your seat, I believe. But hopefully you'll have fun. So I'm going to introduce our presenter. We have, I believe, 5 presenters. Is that correct? Our physical therapist, Nidhi Shah, is going to do a presentation on fall risk and balance training.
I'll use this. Hello, everyone. Good morning. I'm Nidhi. I'm a physical therapist at Covenant Woods, and I'm going to present on fall risk and balance training. And here are my slides. What are falls? Falls is defined as any event that leads to an unplanned, unexpected contact with supporting surface like floor or piece of furniture. A near fall is a stumble, a loss of balance that would result in fall if you were unable to catch yourself. And many people will miss that and ignore it. But we have to pay attention to that as well. Fall are a major public health concern. According to CDC, more than 1/3 of adults 65 years and over half of those 80 years and above fall each year. Results in serious injury such as head injury and hip fractures and many others. Fall could impact the independency of daily life. Fall statistics. 50% of adults age 80 and older fall each year. Every 29 minutes, an older adult in the US dies from a fall. 18,000 plus seniors each year, which is a big number. Denial is a huge problem regarding falls. Only 50% of all falls are reported. People who do fall are 2 to 3 times more likely to fall again within a year. Risk factors. Biological risk factors. Vision changes or loss, mobility problems due to muscle weakness, inner ear disease like BPPV or Meniere's disease, and especially in the inner ear disease like BPPV, people will get dizzy with that head rotation. So instead of going to see a doctor or physical therapist, they are just avoiding the head movements in order to in order to get that balance static. But they should really go with, we do have a couple of vestibular therapists, certified vestibular therapists at our team, so they can help us with that too. Chronic health conditions such as arthritis, stroke, neuropathy, or Parkinson's disease. Behavioral risk factors. History of a previous fall, inactivity or sedentary lifestyle, depression and anxiety, medication side effects or interactions, alcohol use, environmental risk factors, poorly designed public spaces, unsuitable footwear, home hazards like throw rugs, lack of handrail or poor lighting, incorrect size, type, use of an assisted device like walker or cane. Many people don't want to use walker when they really need to balance themselves, and they are using cane sometimes to look good. So if they really need, they start use walker. to prevent fall. How to know if you are at risk? Adults age 65 and older should be screened by their primary care provider on yearly basis to help determine their risk of falling. Also, you should see a physical therapist if you worry about or fear of falling, have had a loss of balance, have had a fall. A physical therapist can conduct brief check or screening of your fall risk by asking you a few simple questions, or maybe they can do like series of tests and assess your balance, ability to how you able to get around, check your muscle strength if that is a thing going on in the muscle weakness. So they'll do all thorough exam. Now I'm going to ask Shanna to come on the stage, and I'm going to show you one simple static balance assessment test. So this is a four-stage balance test. The first position will be putting both feet together and stand in that position without holding on for 30 seconds. Patient can hold this position with arms out or move the body to help to balance, but don't move the feet. Second position will be semi-tandem. So one foot partway forward, and again standing without support, and maintain at least, a normal individual can maintain this position for 30 seconds without having loss of balance. But if, however, a person can't hold any of this position, at least for 10 seconds, then they are at risk of falling and should consider going to physical therapy for balance and exercise and gait training as well. The third position will be the tandem standing, one foot right in front of other. And again, we are maintaining this position for 30 seconds. And the fourth one, the last one, will be a little harder. Single leg stance, standing on one leg. Okay, and this is, again, we are maintaining this position for 30 seconds, and if not, then person is at risk of fall. We are good. How can a physical therapist help? If screening shows that you are at risk of falling, your physical therapist will perform a thorough evaluation, including checking your history if person has previous falls, or some medications like blood pressure medicine or anxiety, depression medicine, they can cause fall as well. So they'll check all history medication, then check the vitals at rest and as well as with activity to rule out if person has orthostatic hypotension or not. Cognitive test will do simple tests to check the thinking ability if person is doing okay or not. Then assessing the balance, physically, balance, strength, and walking ability. Simple vision test, and at the end, feet and footwear. Assessing your feet and footwear. Some residents or maybe person are wearing flip-flops instead of good tennis shoes, good balance shoes, and sometimes it causes fall hazards too. Physical therapist role. Based on evaluation results, physical therapist will design a customized plan that is tailored to your specific needs. Treatment plan may include balance training, strength training, gait training, dual tasking, like doing more than one thing at the same time, like walking and talking safely. Excuse me. Pain management, education, fear management, guide to join community-based fall prevention programs. Evidence-based intervention. Exercise that challenge balance are most effective way to improve balance, like narrow base of support. Just Shanna show us the positions where we can practice those positions under supervision. Minimal upper extremity support, challenging and progressive exercises, longer duration and greater intensity exercises. The minimal dose of balance exercises to prevent fall is 50 hours. No, not for week. Like if we found like person at risk of fall, so they should come like for month or so. Like total dose of exercise will be 50 hours to regain their balance. Remember, you have the power to prevent a fall, a spill, a slip, a hospital trip. Now I'm gonna ask Stacy, our speech therapist, to come on stage and present cognitive part.
Good morning, everybody. Like Needy said, my name is Stacy Mason. I'm the speech therapist here at Covenant Woods, and I'll be talking to you a little bit about fall risk and cognition. Falls are closely related to cognitive dysfunction, specifically executive function impairments, and we're going to be talking about that here in a little bit. The role of cognitive status on fall risk is often overlooked, even though the rate of falls is 8 times higher in individuals with a cognitive impairment. Continued high prevalence of falls among individuals with dementia, despite relatively intact motor function, indicates the falls do not always occur from impaired gait and balance. So what is executive function? Executive functions are a set of cognitive processes that are necessary for the cognitive control of behavior, including attention, self-restraint, working memory, task initiation, planning, prioritizing, organization, time management, flexibility, observation, and stress tolerance. So a lot of things. Okay, number 1, self-restraint, ability to keep ourselves from doing something which is very important for safety. So we don't put our hand on a hot stove, we don't walk out into traffic, things like that. So we keep ourselves from doing unsafe things. Number 2 is working memory. This is a limited capacity that can hold information temporarily, which is important for decision making. Number 3, task initiation, is the ability to start a task without procrastination. Number 4 is planning, determining the necessary of task, which is important for decision making. Organization, planning things carefully and work effectively. Time management, the practice of controlling how to spend your time. Flexibility, the ability to be easily modified. Observation, the act of noticing and actively paying attention. Stress tolerance, staying composed and managing stressful situations. And the most important is attention. We have the ability to consciously pay attention to what we are doing. Attention decreases around the age of 70 years old. This is considered a typical part of aging, but that doesn't mean that you can't work on it. How executive function impacts falls. Self-control, so getting up too fast to answer the door is an example, and dual tasking, walking and talking, are commonly associated with falls. Individuals who score lower on tests of executive function are 3 times more likely to fall. Executive function plays a role in motor control, including attention to balance and gait, and ability to adapt to environmental obstacles. Lower executive function has been associated with mobility decline after a fall and a greater fear of falling. Okay. So, executive function strategies to help prevent falls. Avoid dual tasking while walking. So, what are some examples of this? Yes, that's what I was thinking. Looking at your cell phone while you're walking. Anything else? That's a good one. Carrying too many things in your hands. Okay. Yep. Maybe distracted by something you need to do that's coming up. Reaching over and putting something in your rollator basket as you're walking instead of stopping to do that. Anything else? You guys? Stepping off a curb while talking on the phone. Okay. Yeah, absolutely. That's a great one, yeah. Looking around at the scenery, yep. Okay, all great examples. Okay, the second one is to slow down and be more mindful. We have the ability to deliberately be aware of what we are doing when we are doing it. And that might be something that you have to practice a little bit if you're someone that's been used to multitasking during their lives. Think through how to stand up safely and sit down safely. Pay close attention when doing harder tasks like stepping off a curb or walking on an uneven surface. Schedule appointments and events when you are feeling at your best. If you are not a morning person, try to schedule things in the afternoon. Think about your own limitations and avoid tasks that might put you at risk. Think about your own safety. And exercise your brain. Exercising your brain can help improve memory, attention, and other cognitive functions. Exercises for mental fitness or cognitive health can reduce the risk of falling. And what is the speech therapist's role? Speech therapy can be an incredibly valuable resource when it comes to helping individuals who are struggling with their cognitive health. Speech therapists can identify specific areas, including those involved in executive functioning, that may benefit from training or individualized exercise programs. Training on compensatory strategies and techniques to continue to use in everyday life after therapy has ended can help prevent falls. Remember, you have the power to prevent a fall. And say it with me: a spill, a slip, a hospital trip. And now I'm going to turn it over to Shanna, and she's going to talk a little bit about home safety.
Good morning, everyone. I'm Shanna, and I'm an occupational therapy assistant here at Covenant Woods, and I'm here to speak of the role of occupational therapy and the ways that we can help in fall prevention. An occupational therapist's main goal is to keep you as safe and independent as possible in your current home or environment by looking at the whole person and individualized needs. There's not a one-size-fits-all treatment approach, and that's what makes our profession so unique. A few examples of areas we work on to help with fall prevention are providing home assessments to assess the level of safety within a home, recommend ways to modify your environment to better suit your needs, teach safe methods for navigating various task environments, and we can even provide training for incontinence management, so you're not rushing to the restroom. Some examples that I have here for home modifications that could be done in your home are installing grab bars next to your commode or in the shower, use of non-skid mats in the shower. You could put a tub bench or shower chair so you can sit down rather than stand. And you can install a handheld shower head. In your bedroom, you can ensure that the light switches and telephone are within reach. You could put a night light between the bedroom and the bathroom. You could alter the cords on the blinds so they're easier to reach and open and close. Lower the height of the bed. And you could even rent or purchase a hospital bed if you're somebody that needs the adjustable features. In your living room, it's smart to prevent tripping hazards. It's important to keep electrical cords tucked away, remove or secure throw rugs. You could swap out some furniture for easier furniture to get in and out of, such as ones that are higher, have armrests on them, or ones that don't rock or swivel. And you can unclutter your walkways. In your kitchen, you could consider moving items to lower shelves for easier access. You could switch out dining room chairs for ones that are easier to get in and out of. And as far as mobility, it may be smart to use a rollator, a rolling walker, or a cane when moving throughout the home. Use of visual aids if you have low vision, and wear appropriate footwear. And it's important to always wear your Sarah pendant and know how to call for assistance if you have had a fall. Occupational therapy can provide recommendations for adaptive equipment for individualized needs. We can also provide education materials, resources for how to get such equipment, and training on how to use the equipment. We can also help you install certain things in your home. Some things could be if you're having trouble getting dressed. That could be a fall hazard if you're trying to put pants on while you're standing up and don't have the balance. We have different adaptive equipment such as reachers, sock aids, dressing sticks, shoe horns, and we already spoke about you could add bed rails, toilet seats, all kinds of different equipment, so we can assess your needs and what you need. Occupational therapy can also provide training in safe transitional movements when navigating various environments and task areas. This could mean public transportation, such as getting on and off the bus, in and out of vehicles, use of elevators, whether you're on feet or you're learning how to drive your new power chair, gathering or transporting your food in busy dining room spaces, or putting your groceries away at home or out of the car, and navigating the community in which you live in. Occupational therapists also teach safe techniques for getting in and out of the bed, in and out of the shower or tub, on and off of the commode, in and out of a car, or up and down from various chairs and surfaces if you're having trouble with those. OT can provide medication management techniques and education to better manage chronic health conditions, such as diabetes or fluctuations in blood pressure. A few examples of the ways that we can help manage medication are use of memory aids as reminders, so you don't miss a dosage, use of pill containers or organizers. You can request the pharmacy to provide you with prepackaged daily medication packs or easier open containers. You can even set up home delivery for access to your medications if you're not able to drive. A part of our job is to educate the patient in chronic diseases and provide recommendations for management. We can do this by establishing healthy routines and diets to improve overall quality of life and safe daily engagement in meaningful activities. Down here, I just have a few examples of common health conditions that we see. Some of them might be diabetes, neuropathy, heart disease, arthritis, cancer, mental health disorders, all kinds of things that could lead to falls. And lastly, a topic that's not discussed nearly enough due to the private nature of it is incontinence, but this is very important. Incontinence can greatly increase the risk of falls, and occupational therapists are trained to assist in the management of it. We can do this by providing education in the various types of incontinence and individualizing your treatment needs. Some medications, such as diuretics, can make you go more frequently. Some urinary incontinence medications can have side effects like dizziness, low blood pressure, and blurry vision, so we can take a look at that as well. The need to urinate quickly can affect balance, stride width, and speed, which can increase the risk of falling. At night, waking up to urinate at night can lead to unsafe choices to get to the bathroom and can also cause drowsiness during the day. A lot of the time we see if somebody's struggling with incontinence, they kind of reduce their social activities. Incontinence can lead to reducing social contact and physical activity, which can increase the risk of falling in older adults. If you're staying at home more, being more sedentary, and that kind of thing. Like I said earlier, we can provide education in the various types of incontinence. We can assess frequency and urgency through keeping daily logs, providing recommendations for products for better manage of leakage and to reduce infection, and establish a toileting schedule to prevent rushing to the bathroom or possibly being caught in uncomfortable situations. We also have training and we're able to provide home exercise programs to strengthen the pelvic floor, whether this is for male or female. And here's the slide again. Remember, you have the power to prevent a fall. Say it with me: a spill, a slip, a hospital trip. All right, and now I will hand it over to the fitness department, Connie and Tracy.
Good morning, everybody. I'm going to talk about sarcopenia. Has anybody ever heard of it? No? Some? A few? Okay, sarcopenia is the age-related progressive loss of muscle mass and strength primarily caused by aging, inactivity, and a poor diet. At some point in your 30s, you start to lose muscle mass and strength. You keep losing it as you age, 4 to 6 pounds per decade. If you lose so much strength and muscle mass that you struggle with basic daily activities, you may be diagnosed with age-related sarcopenia or sarcopenia with aging. The downside of sarcopenia is greater incidence of falls and makes you more likely to break a bone. You have a risk for postoperative complications and a longer hospital stays. Metabolic disorders, impaired mobility, osteoporosis, frailty, impaired quality of life, cognitive impairment, even mortality. It's been estimated that sarcopenia affects 10 to 30% of older adults living in the community. Sorry about that, guys. All right. This increases to around 40 to 50% in those aged over 80 or living in nursing homes, and up to 75% in older hospital inpatients. Aging disrupts the body's ability to produce the proteins needed to grow, or maintain muscles. As we age, fewer signals are also sent from the brain to the muscles, leading to a loss in the mass and size of our muscles. There we go. Other causes of sarcopenia include physical inactivity, malnutrition, changes in hormones like testosterone and growth hormones, increased inflammation, and the presence of other age-related diseases. Okay, some symptoms of sarcopenia include, all right, well, let's go back. Sarcopenia is a serious problem. Once you've lost a lot of muscle and strength, you may struggle to do things such as climbing stairs or walking briskly. You may have loss of stamina, poor balance and falls, and a decrease in muscle size. You also can become frail and have a higher risk of falls, broken bones, disability, and even death. Treatment. There are currently no approved medications to treat sarcopenia, and research to identify new drugs has been inconclusive. The most effective approach we have is resistance or strength training, which should be done at least twice a week in combination with a nutritional, protein-enriched intervention. If you've never strength trained before, if you have a chronic condition, talk to your doctor. Gains in muscle mass and improvements in muscle strength have been observed after 12 weeks of resistance training, even in older adults who reside in nursing homes and in hospitalized patients and the very old. After 12 weeks of resistance training, older adults can gain 5 to 10% muscle mass, and they will have 30 to 50% more muscle strength. That's a lot. All right. I need for everyone to stand up who can stand up. If you can't stand up, that's fine. Okay. I want you to hold on to the back of your chair. Or the back of the chair that's in front of you. The front row, if you need to, you can sit down. Okay, if you're sitting, just kind of sit on the edge of your seat, and I just want you to lift your heels and take them down. Lift your heels and take them down. Up and down. And if you're in the back of a chair, behind a chair, hold on, and you come up and down. This strengthens the calf muscles, which are very important for balance. Am I right, PT? Okay, and next is I want everyone to sit down right on the edge of your chair. Get your feet about shoulder width apart. Bring your feet in just a little bit. And we're going to stand up. And we're going to sit down. Stand up. And sit down. Stand up. And sit down. Number one exercise for older adults for strengthening the muscles in the front of your legs, your quadriceps, your hamstrings, as well as your glutes. All of those are very, very important for balance. If you find that you struggle to do that, you just may have age-related sarcopenia. Okay, let's talk a little bit about nutrition. We all know that protein is important, especially for gaining muscle, but you also need carbohydrates. Carbohydrates help offset muscle damage and promote recovery. Your body also needs healthy fats for energy. Protein should be eaten throughout the day for muscle growth, recovery, and maintenance. Men should aim to consume 50 to 60 grams per day, and women should consume 40 to 50 grams a day. I know that sounds like a lot, but if you're eating it throughout the day, you should have no trouble consuming that much. There are many reasons to preserve your muscle. Older adults who strength train have better heart health, lower cholesterol levels, they have improved longevity, they walk and climb stairs faster, and they get in and out of cars easier. Strength training also helps to prevent or ease lower back pain. It boosts your mood. It expands your range of motion by strengthening your joints. And the best part, it helps to improve your quality of life. I'm going backwards, sorry. Am I going backwards? Nerves, it's me. Okay, fitness instructor role. We lead group exercise classes demonstrating proper techniques to help people exercise safely, improving your fitness. We create personal exercise programs and give general advice on a healthy lifestyle. We teach weight training by helping you to strengthen your hips, your legs, and your core, which helps to improve balance and stability. We help you stretch your muscles and joints, which improves range of motion and reduces stiffness, which increases your flexibility. Exercising builds stamina and helps to increase how long you can stay active, making daily living activities easier. Balance exercises like standing on one leg or walking heel to toe help improve coordination and proprioception. Do we know what that means, proprioception? Knowing where your body is in space. Okay, say it with me. A spill, a slip, a hospital trip. And next will be Tracy. Thank you for being patient with me. I get nervous, I kind of screw up.
You didn't screw up. Yes, I did. You're fine. Okay, well, hello again. So I'm going to talk about exercise and myokines. Does anybody know what myokines are? I didn't know till I had to research for this. We used to think muscles were just dumb muscles, and when I needed it, I said, okay, bend to feed me, right? Walk for me. No, they actually release hormones when you contract your muscles called myokines. That's the new word, so just walk around saying that today. So myokines are cytokines or peptides synthesized and released by the myocytes in the muscles themselves. The response to a muscular contraction releases a myokine. So if you've been going to class, going like this, guess how many contractions you got? Maybe one. So I need you to really focus and squeeze that muscle. Yeah. Myokines basically act like an endocrine organ because they produce these hormones. And they release hundreds of myokines when you contract your muscles. And they've just recognized in the last decade maybe 14 to 17 myokines specifically for your body. Some of them include anti-inflammatory properties. Some cross the brain-blood barrier. Say that 3 times. I had to practice, yeah. Which is how you have neurogenesis. It helps create neurons. Adipose tissue, the browning of the white fat, which helps use the tissue. Bone formation, very important as we age, right? Liver glucose production, which is essential to maintain your blood sugar levels. Your gut, pancreas and insulin production. Skin growth, who doesn't want to look great? And the vascular bed, which is a complex network of tiny blood vessels that spread throughout the body's tissue. This crosstalk to other organs is called homeostasis. So, your homeostasis of your body regulates blood sugar, fluid balance, and body temperature. So when you contract muscles, you are helping to maintain that homeostasis to keep your body in check. When that happens, you have the mind-body intercommunication loop happening. So your brain, your mind, your body, all working together. This is important stuff. I hope you're not sleeping. We have a walking challenge to help you contract your myokines, right? Get your myokines going. So when you walk, walking produces these myokines in your muscles and also benefits our brain GPS system. So if I just sit in a chair all day, there's not much happening with my brain, right? I just see the same walls, same TV show. Movement through the world changes the dynamics of the brain itself. So for example, when you're walking along, you adjust if you see a snake in the road, right? Your brain immediately identifies it and you move. Someone else coming, you switch the lane, right? You're switching lanes in the hallway. I'm going to give you an example of one. I want everybody to close their eyes. You made a GPS of this room when you walked here today. Without looking, I want you to point to the exit you're going to leave out of. There you go. So your brain did that mapping on the way here, okay? And it continues to map everything. So it's really good for your brain to walk. And like we said, what's the magic word? Myokines. So our challenge is, one challenge could be 300 minutes a week. You can start on any day, even though it says day 1, day 2, and Sunday, Monday. Just start, okay? We've set out some of the challenges for you. Day 3, 10, 17, and 24, or Tuesday, we have a walking class at 1:30. So if you need help doing the walking paths, we're going to go through those paths, okay? We also have a 600-minute a week challenge, so you can pick either or. One is green, one is yellow. They're on the table back there. Please grab them as you exit. We will have walking tips on the back. So, steps per day, maybe track that. Footwear, hydration. We don't count the steps to dinner. That is active daily living, okay? That's your basal steps, right? Basal activity is going around my house, picking stuff up, okay? So if you walk to dinner and it's not a new task, you don't include it, okay? You need to purposely go for a walk and make it a routine habit so you can get what? Myokines. Thank you. We're going to have a prize, so turn that in. I believe it's the 10th of November we want them back. It'll be in the connections. We'll print it. So we have just created, I mean, this is fresh off the presses today. Connie folded all of them for me. Walking path trifold in the back, and we've mapped out very basic paths. We have paths that are smooth. You know, the terrain is just smooth. It's just complete sidewalk all the way around. We have incline and uneven terrain, which would be the spring, walking back behind Manor East, up the hill and all that stuff, and, you know, going off the curb. And then we have the pond, and we have mapped the nature trail, Dawn, just for Dawn. He loves that trail. If you need help with the trail, he has offered to help take you there. Dawn, raise your hand. He's in the back. So if you're interested, please do the nature trail. Remember, a spill hospital trip. Okay, now the rehab department is going to show us Get Up From a Fall. Stephanie is not here, so Jenny is coming. I'm sorry, Kelly. Kelly is replacing Stephanie.
So if Shanna will demonstrate how to get up from the floor if some person has fallen on the floor. Sorry. So now we are going to present that how to get up from the floor. All right. So if you haven't hit your head and you are not hurting anywhere, then you can get up, roll on your side, either get onto hands and knees and crawl to or slide to the sturdy piece of furniture like chair, stair, or a handrail. And try to put two hands, both the hands both hands on the chair, and then one leg forward. And push up with your arms and legs. Pivot your bottom around. Sit down, rest before you're trying to move.
All right, well, thank y'all for coming. I'm Kelly. I'm actually one of the occupational therapists here as well. But basically, just to let you know about the services that we do offer, we have physical therapy, occupational therapy, and speech therapy services here on site. We have the gym in the Manor, and then we also see patients over in Manor East, upstairs in the healthcare unit. We can also come to your apartment or your cottage or your home, wherever you need us to come to work on all of these different things for your safety. So how do you get started with therapy? First, we do have a sign-up sheet up here. So if you are interested in anything, a screen, have more questions, just write your information up here and then we can get in touch with you and kind of go further over that. Or you can always reach out to your doctor, get an order for therapy, and then you would give that order to anybody from therapy.
you can take it downstairs to the gym, or you can contact Stephanie, and then we would get you scheduled for the evaluation. Okay? But we also have up here on the table is just some of the equipment that Shanna had talked about, and feel free to ask questions. We'll kind of hang out afterwards. But thank you all for coming, and have a great day.
If you didn't sign in, please sign in. And we have the walking challenge and the walking pass on that back table. The front table is physical therapy stuff up here. Thank you.